but, from Skip and I's standpoint, as we're meeting with employers, we're trying to shift their focus from, okay, quit buying insurance and you need to start buying healthcare and remove as many middlemen as possible. And, with the Orthoform Value Network, those things are possible because that's what we want to do is remove all the profiteering middlemen, remove the margin, get people to high quality healthcare that costs less.
So let me ask you guys a question. How many people understand that?
Not many.
That's the challenge, isn't it?
Yeah,
we get it because we've been looking at it. I've been blessed enough to be on the employer side and the provider side, so I get this 360 view. Right? It took some time, but I get it now. How many of the people that you talk to actually understand it?
It is, a hard thing to wrap your mind around because sometimes when we are talking to employers and these are all new concepts to them, they're like, well, is this new to Des Moines? Is this new to Cedar Rapids?
Yeah.
And no, it's happening all over.
Yep.
These little, as our friend Matt Ort would say, these little brush fires. And, through education, and, that's the purpose of this podcast is just to get the education out there. They don't just want to hear from us. They want to hear from people that sit on your side of the table that in healthcare. So that's why your point of view is just so important.
Well, that mission alignment also includes that when we do develop these relationships where you put your bundles out there and we start working with different platforms, we just got you lined up with another one a couple of weeks ago, Host Care. And so your bundles are going to be out there. So as the nurse navigators that are connected to the DPCs and you're through the OVN, you're going to get pinged for a national employer. You're, again, in 18 different states at this point, and it's going to keep growing. But the mission alignment for the broker side is, at least I am going to speak for you, is that, once we build these things out, then it's for everybody to enjoy, right? Because you can't build a tree, right? You got to plant the seed and you got to work really hard at it. And I think that, we started coming up with these concepts and ideas. We're like, we're going to go like a scalded dog through this thing and we're going to blow it all up, baby. But, it's taken a long time because it's been a too good to be true.
Yeah.
And we have, I've always said we're kind of like pioneers, and we got, there's a lot of varmints out there that are trying to, say this is not going to work. And so there's that doubt, and healthcare is an emotional transaction, and people think their insurance guards are their doctors. And when that happens, it's really hard to get through to them that this is going to be great. And that's why I said before we even got rolling here is the testimonials. That's the thing that you can't put the cork on.
Right.
Is when the patient says, this was great, thank you so much. That's the difference maker that has never happened with all these shiny brochures, and we're going to put a wellness plan in, and we're going to, we've been through all these iterations.
Right.
And we're going to make it better, I promise. And so, we've run out of material. And so that's why we were saying, well, it's time to either retire or innovate. And so it's that alignment is what I'm getting to. With the brokers have to be aligned with the providers. And when you do that, you're all at the same side of the table. And that's the other thing. It's like, that's what calms down a lot of these doctors' offices, clients, is when we're like, well, meet our DPC. He's here to, we'll talk about the insurance when it's our turn, but we want to talk about what the experience is going to be for your employees.
Mm-hmm. I think you're getting the pressure too. But what's meeting that, why I call it a tipping point, is as an employer, that was our journey, is we had to do something. You guys came to us and said, if you go to the really big building in downtown Des Moines that has blue facade to it, it's going to end up costing you like $1.2 million next year. And we looked and went, we can't do that every year, more than what we're paying. We can't do that every year, because then we can't put in an urgent injury in Norwalk that services people. We can't give raises out to employees. We can't do all those things. So we took that journey of, let's start with DPC. Let's go self-insured, which was incredibly scary for a group that's never done it before, because the first thing you think is, oh my God, if everybody gets sick, we're done. Mm-hmm. And could that happen? Sure. But does it happen? No. And there's a lot of other things you've taught us that go into putting guardrails on that. But once we're able to put in a good network, a DPC, and then a good network that our employees could go to, and then the most important part was we got our PBM. What was the number we saved our first year on the PBM? Do you guys remember? I want to say it was like $400,000 compared to what it would have been. It might have been higher.
I think it was $322,218.
It was a lot.
It was like $300,000, Rich. Yeah. It was like, that's how many jobs is that?
It was a lot. Yeah. And we've seen that every year. So from an employer standpoint, when you hear something like that, the other CEOs that I talk to in other businesses and industry go, hey, wait a minute, how'd you do that? And then you say, okay, we're gonna have a conversation. You can't fall asleep.
Yeah.
You have to be, you got to be focused. We'll take this little bits at a time, right? Maybe over 3 or 4 days, but we'll get it done. And then once they get it, they're like, oh, we can do that.
Yeah.
Well, I think some employers get stuck, looking at their renewals 12 months at a time, and you need to look at it as a year approach. Because to your point, if you're constantly increasing your costs every year, you can't innovate, you can't grow, which means you can't serve the community that you're in. So there's all these other downstream things that people don't think about. And I think employers are in the same boat. You got a manufacturer that has, 300 employees and they're continuing to see increases. Well, that's less pay raises. That's, maybe they want to do an expansion and all these other things in their community. And I just don't think people think about how much just renewing every year just hurts their business and their people.
They're stuck in the process, right? We're gonna come meet with you in August. We're gonna give you our end of year results in October, and we're gonna come to you in November and say, here's the price. You've got 20 days to sign this piece of paper. Yeah. And they're going, wait a minute, I can't negotiate? No, you can't negotiate. Yeah. This is what you have to do. And then they get pissy for, hopefully I can say pissy, they get pissy for however long, right? And then by February, it goes away, and they don't think about it until August of next year.
That makes me think of, I just had a recent conversation with an employer, and I feel like some employers just don't think it's possible. And
Correct.
This is just how it goes. We increase our premiums, or we eat the costs as the company, or we raise deductibles. And this particular employer, they've got a very low deductible. Their costs are continuing to rise. Not high earners, so they recruit and retain off their benefit plan. And she was like, well, I think we need to add a high deductible health plan. And I'm like, you're going to try and move people from a $500 deductible to at least, what, $1,800 is the minimum high deductible health plan. I'm like, are you doing that because you think it's a good strategy or because your costs are going up? She goes, well, our costs are going up. It's like, well, what if you were able to do things to reduce your costs so you didn't have to move to the high deductible health plan? It's like, oh, that's a good point. But some people just, I think, are conditioned to, hey, costs are going up. It's reality. It's happening everywhere. We just have to accept defeat.
It's the only lever they know how to push, right?
Yeah.
And then eventually the deductibles get so damn high they can't do anything with them.